Hi everybody, my name's Siva Vasudavan. I'm one of the orthodontists on the Cleft, Lip and Palate team here at Children's Hospital Boston, and a couple of other gentlemen that work on this team that you'd probably be very familiar with, Dr. Schusterman and Dr. Bruin. What I'd like to talk about today is some of the treatment that we encounter in our adolescent years. And if we take a step back and look at the amount of treatment that we have from birth to 21 years of age, there's a lot of treatment. And if we think from the time you were 7, we were working on you to get you ready for a bone graft, and then afterwards getting ready to using some braces to get your teeth set up. And now when you're in your late adolescent years, we're talking to you about having another stage of treatment and surgery to go along with that treatment, and then finally having some restorations of your teeth being performed. Up to the time you were 15 years of age, your parents largely made those decisions for you of what treatment that you needed and essentially other major things in your life. But now, as you're a little older, you're the person that's going to determine what's right for you, and with some guidance from your parents. There's some things that you want to ask yourself when you're making these decisions. First of all, you have to ask yourself, what is important to you? What are you specifically wanting to achieve for your treatment and the kind of result that you're after? The other things that you want to consider is what can be done. And us, the team here at Children's, are the ones that are going to be able to give you that information. And one thing you must remember, there's more than one way to complete your treatment. So when you determine what is important to you, you have to determine whether you want all the treatment or none of the treatment. But it's important to be flexible. Identify your concerns and then come and ask us questions. Ask your parents questions. Ask other children who've had this treatment questions. One of those things that you may want to consider is if you don't want to have all this treatment in your late high school years or college years and you want to delay it till you're much older, that may work, but there might be some insurance hassles that will be in your way, and also you might have to take some time off for additional surgeries, and taking time off from work can be a problem. So this may become more inconvenient to you if you wait till you're older. Now, complete cleft lip and palate requires extensive orthodontic management, and we try to carry out this in a coordinated intensive burst of treatment at a critical stage of your dental development. When you're in the permanent dentition, we like to try and do all the final tooth alignment so that your occlusion can be established and you can have a nice smile. Now, sometimes due to, and we'll get to reasons why, the surgery of the upper or lower jaw is performed to alter the position and the relationship of the jaws. It's performed at skeletal maturity to minimize the potential for relapse associated with further growth. Specifically, your body grows in a different gradient of growth. The top jaw tends to grow first and before the bottom jaw, but the bottom jaw continues to grow after your top jaw is finished and will actually grow much more. So what we end up is a complete imbalance between your top and bottom jaws. So if we look at some patients who've had jaw surgery, and we look at this young man prior to surgery and post, we can see some significant changes that have occurred. Specifically, he shows a much improved lip relationship. And if we look at him on profile, we can see that his profile has gone from a very straight or even concave profile to one that's balanced, where the top and bottom jaw are in harmony and his nose and top and bottom lips are in complete balance. If we look at another cleft patient, we can see that pre and post surgery the teeth have been lined up, and pre and post surgery we can see there's a big difference in the mid-face here and here, where there's a much more pronounced fullness to the middle of her face, and the upper lip is in a much better relationship. We can see that the braces have been used to align the teeth prior to surgery, and once the braces come off, we've established what is a nice functional bite and a very pleasing smile. This type of surgery is also routinely performed for children and people that are born without a cleft lip and palate. We can see that this gentleman has what we call an open bite and an underbite relationship, where the top and bottom teeth don't overlap. once we can use surgery to establish a functional bite and a pleasing smile, and this is by bringing the top jaw forward and even bringing the bottom jaw back. So we can see on this patient's x-rays, the top jaw has been brought forward and the bottom jaw has been set back to achieve a nice balanced bite and smile. Now, another option that we sometimes use is called distraction osteogenesis, where we use an external fixation device to bring the top jaw forward over a gradual period of time. And we can see here where where the patient was prior to distraction and then post-distraction. And you can see there's also a big difference in their facial profile and balance. Now, the issues of missing teeth. Children with cleft lip and palate are often born with a number of missing teeth, and this is typically in the area of the cleft. Today we have more choices, but each has unique challenges, and there are high aesthetic expectations, and this involves interdisciplinary treatment between the orthodontist, the oral surgeon, and a restorative dentist called a prosthodontist. The choices that we have to address missing teeth, one is to do nothing. Usually that doesn't achieve a very good outcome though. We can close space with or without a restorative assistance, and sometimes we can open space to allow prosthetic rehabilitation of the top jaw. Both scenarios can be successful, and the key to success is specific case selection. But what we try and do is drive it using what will be the highest aesthetic outcome. If we look at this patient here, this picture right here in the top right, we can see that this patient has their midlines being coincidental and a nice aesthetic relationship. And the layperson is unable to determine that these teeth here and here are actually canine teeth that have been brought to sit next to the central incisors and be reshaped. Similarly here, these are implants, and they're placed into the top jaw where there was the space was to replace the space for the missing teeth. So both this tooth and this tooth, which are lateral incisors, have had implants placed in them. Sometimes we can get away with reshaping teeth, but this depends on the size and the color of the teeth. So if we look here, we can see that the canine tooth has been brought forward and reshaped, and this yields a nice balanced result. Similarly, this is a scenario where the patient here has a smaller shaped lateral incisor on one side and is missing the space, or missing the lateral incisor on the left side, and this has been opened up for the placement of an implant. So what are the issues with implants, and why can't we do this earlier while you're still a teenager, and why do we have to wait till you've finished all your growth? It's essentially because the top jaw tends to grow in a downward fashion, and if we were to place the implant too early, what would happen would be it would fuse into the jaw and not have the same ability to erupt as the other teeth. So these are what implants generally look like, and you can see that they're of a size and diameter of about 3.5 to 4 millimeters. So the orthodontist works to open the spaces for the implants to be placed. This is what an implant looks like radiographically. So we can see the central incisor tooth here. This is the implant substructure, and this is the canine tooth, and a crown gets fitted above that substructure. So we can see a patient here, or a different approach, where the canines have come in adjacent to the central incisors, and they've been distalized so that we can have some build-ups done, so some temporary build-ups. Sometimes when you can't get enough space for an implant, we've got some other tooth-supported restorative options, and that in this case here, this patient didn't have enough space in her top jaw to have that implant placed. So what we did was we opened the spaces up, but then we used some restorative bonding material to temporarily close the space, and then used a cantilevered bridge that was cantilevered off the canines on each side to create a smaller tooth that's going to fit adjacent to it. So that we end up having a 6 anterior tooth segment, but that's something that a patient can function with and yield a nice smile. Other options for replacement of teeth include using a partial denture, where there's a tooth is attached to some plastic and metal framework that is attached to the adjacent teeth. So that was a brief synopsis of all the different treatment options that you'd have when you're later on, including your orthodontic work, the surgery, and the choices for replacing missing teeth. I'd like to thank you for your attention.